Hello, this is Chris Severin, CEO and co-founder of Turquoise Health. Today was a busy day for price transparency. CMS dropped a new proposed rule with many elements, and here's a summary of the top 10 highlights of the 57 pages targeted at hospital price transparency for all of you busy folks heading into the weekend. Number one, CMS published the rule to take effect on 1/1/24, so all of the elements included have a 1/1/24 go live date, except for one. There's a 60-day grace period for complying with the new MRF standard template, and that would take effect on 3/1/24. Number two, this new MRF standard template will be required, and it will include new foundational data elements that make it easier for everyone, third parties, CMS included, to track data hygiene. So we'll see things like file version, update date, hospital identifier, address, and name. And this is stuff that at the aggregate level makes it easier for everyone to have better data hygiene and to report atop the data. Number three, there are new requirements that make it easier to access the MRF, both for consumers by having a friendly name in the footer of the website, but also for automation by putting a TXT file that points to MRFs in the root of the website. And we go into more details on that in our long form summary. Number four, there's a lot of new columns beyond the original 5 that are being required explicitly. A few highlights include payer and plan being split out, drugs, units, and type of measurement being split out and explicitly required, reimbursement methodology, so gone are the days of just dollar amounts, but now we'll see percent of charge, per diem, and a long tail of other types of reimbursement. And then finally, there's an additional information column that is more of a catch-all that CMS puts some aspirational data elements that they'd like hospitals to include, but are not required. Another big highlight that I'll call number 5 is when rates are non-dollar, CMS announced a new data element called the expected allowed amount that's meant to be consumer friendly and to come up with an average, an estimated reimbursement for algorithmic type reimbursement methodologies that are not paid at a straight dollar rate. So that's really interesting, has a lot of implications that we go into in our long form breakdown. Number 6, CMS wants to ramp up enforcement in several ways with increased accountability and also making it easier for CMS to enforce atop these standard data elements. A few highlights: they want to publish a list of compliance actions, not just the civil monetary penalty, but even actions further upstream of that. And you could picture this as a more public naughty list, if you will, of hospitals that don't currently have a compliant file. And I would assume they'd also publish hospitals that are compliant as well. Another element there is the ability to contact health system leadership, not just a hospital directly, when CMS suspects that a hospital's file is actually under the responsibility of a larger health system. And rolling up into ramping up enforcement and that accountability is just the acknowledgement of receipt when CMS sends a letter about monitoring and assessment. And I guess that was an issue before. Number 7, this is interesting. CMS wants to facilitate a choice for consumers and I think for the industry between dollar amounts and algorithms. They make a note about consumers having the right to go somewhere with a fixed upfront payment that can be expected versus an algorithm that's more of an estimate in a wider range. So they really put their thumb on dollar amounts versus estimates and algorithms. 8, as we kind of close out the summary here, CMS seeks additional information on the consumer-friendly display of shoppable services and really how that could be more aligned in the hospital price transparency rule with other efforts in transparency and coverage and NSA. They also say, is there a standard service package library for shoppable services that maybe could be used across all 3? Number 9, it looks like the No Surprises Act, good faith estimates and advanced EOBs for insured patients are still under consideration and quite a ways away. Number 10, and where we'll close in this quick summary, they just want to seek information on how third parties like Turquoise and others are using the MRF data to develop consumer-friendly search tools, and maybe how we'll do that in the future. So we'll be interested to provide comment and see what other comments folks post. So there's the summary of today's CMS proposed hospital price transparency final rule.